Dr. Simmons, welcome back to ISF.
Thank you for having me. Great to be back.
Yes, today we're going to discuss bariatric surgery and bariatric endoscopy.
It's one of my favorite topics.
Great.
One of my favorite topics.
Tell us all about it.
Yeah, so I think it's really important to have a clear distinction between the two, bariatric surgery and bariatric endoscopy. Sounds similar, but there are a few key differences. So bariatric surgery is just that. It's surgery, right? So there's cutting involved. There are incisions involved. And the idea with bariatric surgery, twofold. One is focus on restriction, so making the stomach size smaller. And two, there's some rearrangement of the small intestine with some of the surgeries focused on what we call malabsorption, meaning that food is not contacting certain parts of your digestive tract, so you're not really absorbing as much, leading to weight loss. And bariatric endoscopy procedures are non-surgical. So the way that we do these procedures, by accessing the stomach through the mouth to get to the stomach, and once I'm inside the stomach for these procedures, we're able to do a few things to reduce the available space in the stomach, which leads to decreased food intake and long-term weight loss. And the other key with these procedures is that it slows down how fast your stomach is processing food so that you feel full for longer. So again, the key, bariatric surgery is a little bit more invasive and requires surgery. Bariatric endoscopy, non-surgical procedure for weight loss.
Thank you for that description. Now, what are the pros and cons for each individual one?
Yes, and I think a lot of that is centered on the fact that bariatric surgery, again, is surgical, right? So with a surgery, you are going to have more weight loss with the bariatric surgeries, but with surgery, there will be more risk, right? So there's risk of things like leaking from the digestive tract, and patients who have surgery often need to be on vitamins due to issues with absorption. Whereas with bariatric endoscopy, it's a less invasive procedure, right? We're just going in through the mouth and not having to cut anything. So patients get to go home the same day. There's a much shorter recovery where they're able to go back to work and to their activities of daily living within 2 to 3 days.
That's great.
And then you get substantial sustained weight loss with these procedures as well.
That's excellent.
Yeah.
And now, who is the ideal candidate for bariatric surgery and bariatric endoscopy?
Yeah, so ideally, I think mentality needs to be that these options, whether it is surgery or endoscopy, are tools for weight loss, right? What has to be accompanying these procedures or these surgeries are lifestyle changes. So the ideal candidate is aware that this has to go along with lifestyle changes. In terms of the weight requirements and other things, that gets more individualized, and you'll have to consult either me or whoever you're seeing for these weight loss procedures or surgeries. But in general, a BMI or body mass index between 30 and 50 is ideal, and somebody who understands that this is a tool to help with weight loss.
Okay. And now there are future developments for bariatric endoscopy. Can you tell us a little bit more about that?
Yeah, so bariatric endoscopy is newer relative to bariatric surgery, which has been around for decades. So along with that, a lot of exciting developments, as you mentioned. And I would say one of the key things is combination therapy. So we all know either someone personally or someone who's on these medications for weight loss that have gained a lot of popularity recently. And we're looking into the combination of these procedures that don't involve surgery along with medications and seeing how much weight loss we can get. And it seems like that is going to be more weight loss than either of those individually. So the combination therapy is a really exciting area that's being explored right now.
Well, thank you so much, Dr. Simmons, for sharing everything we need to know about bariatric surgery and bariatric endoscopy. Where can we go for more information?
Yeah, so for more information, you can visit our website, www.simmonsweightloss.com, or you can call our office, 305-204-8558. We'll be happy to give you more information.
Thank you so much for joining us on ISF.
It was great to be here. Thank you so much.